Okay, great. All right, so just for my record here, could you state your name and spell it, please?
Okay, it's Carole, Carole. Last name Barasch, B as in boy,
Okay.
Arasch.
All right, thank you, Carol. And could you just really quickly state your position there with Austin Travis County Health and Human Services?
Okay, I'm the communications director for Austin Travis County Health and Human Services.
All right, thank you.
I'm the communications manager.
Communications manager, okay.
Not the director, I'm the manager. I'm sorry, I got
Oh, no, that's all right. But I'll definitely identify you, so thanks for making sure that's right. Okay, so we'll just dive right into it. So thus far in 2012, there's been 56 confirmed cases of West Nile virus in Travis County and 3 reported deaths. Based on your department's estimates and forecasting, what do you expect will happen to the number of reported cases?
Well, actually, as of today, we have 63 confirmed human cases, including the 3 deaths. Several of these cases have been hospitalized, 39 out of the 63. And of course, we don't know what the outcome is going to be. What I can tell you is we are starting to see some downward trending of cases, of human cases, as well as the positive mosquito pools.
Okay.
That's very encouraging news. We wouldn't declare that we're out of the woods at this point, but it's very encouraging, hopeful news that that we've begun to see.
Good. That's great to hear. So to follow up on that, how is your department currently combating the spread of West Nile virus? What are some of the things you guys are doing?
Well, all along we've been following an integrated mosquito management approach that emphasizes education, surveillance, and targeted larviciding and adulticiding. The adulticiding takes place in the county only. The targeted larviciding is something that we also do in the city.
Okay. And is that, I guess, hand application of the adulticide, or how does that work?
Yeah, I'm not sure exactly, what that looks like. I think it's kind of like a backpack device that they, have attached to the sanitarium that goes out there and operates that. But, it's very specific areas, so it's not broad spraying.
Okay. Well, thank you. So at this point in time, Travis County has decided not to conduct an aerial spraying program as opposed to what we've seen in other major urban areas in Texas like Dallas, Houston, and San Antonio. What should be the correct criteria for conducting aerial spraying?
Well, let me correct you first.
Okay.
We have been saying consistently that we would consider all options. We have conferred with the Department of State Health Services on last Friday and this past Monday to talk about the various options, and those options include targeted ground-based and aerial spraying. So we haven't ruled out any options. I think that's really an important message to get out there.
Okay. That
all options remain on the table. What we are seeing is some very encouraging downward trending of both human cases and positive mosquito pools. Again, we aren't saying we're out of the woods, but we're hopeful about this, and we haven't seen a new case since a human case since September 1st. We will continue to see kind of a lag time because there's a lag time in reporting. So it might be, we could expect to see more cases, but we haven't seen cases that onset of illness began after September 1st. So that's really good. So we haven't seen any new cases since September 1st, essentially.
That's great to hear. And then going back about
3 weeks of human cases declining.
It's been 3 weeks of decline. I see. Thank you. Thanks for spelling that out. So then on September 8th, and I know you just mentioned this, last week, staff of your department met with Dr. David Lakey, who is a commissioner with the Department of State Health Services and has been assisting other counties and cities with aerial spraying programs. And really my question here is very simple. What can you tell me transpired during the conversations that were held at that meeting?
Well, we took a look at the current data, and Dr. Lakey essentially, he was saying it looks like your numbers are trending downward, and that's what we were, that's the same evaluation that we concluded as well. And we knew that at least the weather forecast was calling for cooler temperatures, and we know that mosquitoes are less active when temperatures dip below 70. And so what was decided at that meeting was let's meet back on Monday and look at what's transpired over the last several days, because we were hoping that the cooler temperatures would reduce mosquito activity. And initially that's what we're starting to definitely see in terms of the mosquito pools being negative rather than positive.
Okay.
So
good.
That's a good sign.
Downward trend is what I keep hearing, so that's good. Okay, so moving on here, just a few more questions. Won't take up too much more of your time. Now, according to the City of Austin website, there's a little article up there that states they basically looked at the numbers and all the confirmed cases of West Nile and found that the average age of those, I guess there's only been 3 in Travis County, but the average age of those that have died from West Nile is 79 years old. So my question here is, does Travis County really have that bad of a problem with West Nile that we need aerial spraying?
Well, I can't really address that. Again, aerial spraying is, remains an option.
Right.
But West Nile, the CDC's profile for those most at risk would be people over 50 and those who have a compromised immune system. So we have urged everyone to follow the recommended measures, and those measures are we want people to stay out of, to stay indoors at dusk and dawn, to dress appropriately when they are outside with pants and long sleeves, to use a repellent with DEET, and what's become increasingly important is for people to drain water that's collected around their property. And this is they're all important measures, but what we found is that people can look around their property and survey it, and they still don't see the water in the bird bath as being problematic, or the water that's collected in a flower pot that they watered the night before. And these, mosquitoes can't breed without water. So these are the educational measures that we know are effective strategies for limiting exposure and to mosquitoes and limiting the breeding grounds.
Okay, well that definitely makes sense. So, and so what would you say is the likelihood that your department will recommend aerial spraying for Travis County in the near future?
Well, we're going to continue to, look at the data, and again, we would consult with the state commissioner, the Department of State Health Services commissioner, and county folks and city management. But we'll be informed by the science and the data that we collect, and if we continue to see downward trends both in human cases and positive mosquito pools, then that will be one of the things that we factor in as we look at next steps, and we'll evaluate as we need to.
Okay, that makes sense. Just a couple more questions here, and then I'll let you go on your way. Now in Dallas, I know that they had used a compound when they did do aerial spraying called dual action adulticide, also known as, it's basically synthetic pyrethroid, if I'm saying that right, and that's mimics a substance in chrysanthemums, and it's supposed to kill the mosquitoes. You might not have the scientific background for this, but I was just curious if you know what effects on the citizens' health would a compound like that have if it were to be aerial sprayed?
Well, Clay, you actually said it. I don't have the scientific background to be able to comment on chemicals that would be, recommended for use. So I'm going to have to step away from that one. Okay.
Now, this one's a little more general. Do you think the risk of spraying would outweigh the benefit if it were to come up that there were more cases? I mean, I know it's a decline trend. Let's say it went the opposite way. Do you think that the risk of spraying would outweigh the benefit, or vice versa?
Again, the data is going to instruct, the kinds of considerations that we might choose.
Okay.
And at this point, it's done in a collaborative way to reach some sort of consensus. And at this point, we're continuing to evaluate on a daily basis where we're at. And again, with the cooler temperatures, we're encouraged with seeing negative mosquito pools and fewer human cases, especially 3 weeks of human cases declining.
That's a great sign. That's so great to hear. Just one more question, if I may, and I'll let you go. The spraying that does exist now, which is what you describe, guys with like packs, and they have the adulticide, and they spray in certain target areas that are breeding grounds that you guys have identified as breeding grounds. Has there been some sort of study on that, or some sort of assessment of what that spraying does to our ecosystem here in Austin in the long run?
I haven't seen a report like that. That's something, that if you needed, additional information, I could check with our environmental folks on that.
Okay.
And get back to you, but I don't know about the impact. I know that it's very targeted and it's used rather, as necessary, but sparingly. Right. So, what's probably most important is for folks to make sure there's no stagnant standing water on their property. Mm-hmm. Because our folks our sanitarians have, they're monitoring these areas where they've seen mosquitoes breed in and around on public property. What they've also seen is that there are private property owners that have water in flower pots, in bird baths, in tires, in rain gutters, and other areas where, people may not factor that in, and when they think about water collecting on their property, and that's something that we really feel is crucially important, is to get the public on board to look around, get rid of that water, and limit their exposure to mosquitoes.
Great. Well, thank you so much. I appreciate all your help with this. And yeah, I'd love to get in touch with someone if possible. If you could, you don't have to give it to me right now, but if you want to call me back or leave a message, or I can even give you my email, and to be in touch with someone in the environmental department on that last question would be great, just to find out more. But I'll
ask and see. I'll send an email to staff and see if they can provide any a study about the effectiveness of the larviciding and adulticide tactics.
Yes.
Is that what you want? Okay.
Yes, that would be very helpful. I would really appreciate it. But yeah, thank you so much for your time. You're very informative, and it was a real pleasure speaking with you. And I thank you for speaking with me. Sure, anytime. Thanks very much for the opportunity. I appreciate it. Absolutely. And if you'd like to listen, I will be giving a report on this topic, and we'll probably use a quote or two from you tomorrow morning around 7:20 a.m. on KDRP. It's 103.1 FM and 100.1 FM. So either of those. 100. What is it? 100. 103.1 FM. 103.1 FM.
Okay, 103.
Or 100.1 FM. They've got a couple different spots on the dial, so it depends. I forget which one, but it depends which part of town you're in, what you can pick up. So.
Okay, that sounds great. Well, thanks for that information as well.
Sure. Great. Well, thank you, Carole. And if I have any other health questions or questions that are relevant to your department in the future, is it all right if I contact you?
Sure, that'll be fine. I'll
Okay.
help you as best I can, okay?
Okay. Well, thank you so much for your help. It was a real pleasure.
Yeah, same here. Thank you.
All right. Bye.